Hi, in this video, I'm going to talk about vertigo-associated disorders. The most reason for this kind of disease, and especially give you the natural treatment for it. Well, you know that vertigo is one of the most common medical complaints. You can see that vertigo is the feeling that you're moving when you're not. Or it might feel like things around you are moving when they aren't. And it can feel similar to motion sickness. However, people experiencing vertigo generally describe the sensation as feeling dizzy or feeling as if the room is spinning. In fact, vertigo is not the same as lightheadedness. And the most common causes of vertigo are benign paroxysmal positional vertigo, Meniere's disease, and acute onset vertigo. For the treatment, it really depends on the cause. Popular treatments include certain physical maneuvers and, if necessary, special medications called vestibular blocking agents. About outlook for vertigo-associated disease, it depends on the cause. Unluckily, acute onset vertigo attacks generally last less than 24 to 48 hours. Meniere's disease doesn't have a cure, but there are ways to manage the symptoms. You can see that there are two categories of vertigo. Peripheral vertigo occurs as a result of a problem in the inner ear, or the vestibular nerve. The vestibular nerve connects the inner ear with the brain. With central vertigo, it occurs when there is a problem in the brain, particularly the cerebellum. The cerebellum is the part of the hindbrain that controls coordination of movements and balance. About 93% of vertigo cases are peripheral vertigo, caused by one of these following. First, benign paroxysmal positional vertigo, which is vertigo brought on by specific changes in the position of your head. It's caused by calcium crystals floating in the semicircular canals of the ear. Second is Meniere's disease, which is an inner ear disorder that affects balance and hearing. And third is acute peripheral vestibulopathy. It is inflammation of the inner ear, which causes a sudden onset of vertigo. How about causes of central vertigo? Well, they include stroke, a tumor in the cerebellum, migraine, and multiple sclerosis. However, treatment for vertigo-associated disease depends on the cause. The vestibular blocking agents are the most popular type of medication used. It include antihistamines, benzodiazepines and antiemetics. But there are some treatments for specific causes of vertigo. With acute vertigo attack or Meniere's disease, you need to have bed rest or antiemetic medications. With benign paroxysmal positional vertigo, you need to do Epley repositioning maneuver, which is a specific movement that loosens the calcium crystals and clears them from the ear canal. Don't forget to avoiding alcohol. Beyond the dizziness you feel while drinking, alcohol can actually change the composition of the fluid in your inner ear, according to the Vestibular Disorders Association. Alcohol also dehydrates you. These things can affect your balance, even when you're sober. Cutting back on alcohol consumption, or even stopping completely, might help your vertigo symptoms. And sometimes, vertigo is caused by simple dehydration. Reducing your sodium intake may help. But the best way to stay hydrated is to simply drink plenty of water. Monitor your water intake and try to account for hot, humid conditions and sweaty situations that might make you lose extra fluids. Plan to drink extra water during times you tend to become dehydrated. You might find that simply being aware of how much water you're drinking helps decrease vertigo episodes. That's going to be the video. Don't forget to click the link in description to find out the natural treatment for vertigo that help you treat it easily.